Hello, beautiful people. Welcome back to our space. Today, we have a very important topic, which is why those implantations sometimes fail even after fertilization. Yes, many people believe that once the egg meets the sperm, pregnancy is guaranteed. But that is not how it works. Fertilization is only beginning at this point. For pregnancy to continue, the fertilized egg, now called an embryo, must travel to the uterus and successfully attach to the uterine lining. This process is called implantation. Unfortunately, implantation does not always happen. Let's talk about some possible reasons. Do you understand? The embryo may not be healthy. That's number one reason. Not every fertilized egg develops into a healthy embryo. That's the truth. Sometimes the embryo has chromosomal abnormalities that prevent it from growing normally. It in many cases, implantation either doesn't occur or the pregnancy ends very early, often before a woman even realizes she was pregnant. This is one reason why fertilization alone does not always result in. Two is that the uterine lining may not be ready. For implantation to occur, the lining of the uterus must be thick enough and properly prepared. If the lining is too thin or not receptive at the right time, the embryo may be unable to attach successfully. Three is hormonal imbalance. Hormones play a major role in preparing the uterus for implantation. Conditions involving low progesterone, thyroid disorder, high prolactin, poorly controlled hormonal condition may affect the environment needed for implantation. If these conditions are present, your healthcare provider may recommend treatment based on your individual evaluation. Four is the uterine problem. Certain conditions inside the uterus can interfere with implantation, including endometrial polyps, some fibroids, depending on their size and location. Intrauterine adhesion, that's like scar tissue, a congenital uterine abnormalities. This may reduce the chances of successful implantation. You see, number five is age and egg quality. As women get older, especially after age 35, egg quality generally declines. This increases the likelihood of embryos with chromosomal abnormality, which can reduce the chances of successful implantation. Number six is lifestyle factor. General health also matters. Smoking, excessive alcohol intake, obesity, uncontrolled diabetes, and poor overall health can reduce fertility and may affect implantation. Improving your overall health before pregnancy can support reproductive health very, very well. Now, does implantation failure mean you can never get pregnant? Absolutely not. No is the answer. One failed implantation does not mean you will never have a successful pregnancy. Yes. For example, I have had one failed implantation, do you understand? And it never stopped me from having other successful pregnancy. Many women who experience implantation fail later conceive successfully. I'm an example, yes. Later conceive successfully after appropriate evaluation and treatment. The key is to identify any underlying issues rather than assuming fertility drug alone will solve the problem. Just identify the exact issue and you see yourself carrying your beautiful bundle of joys in your hand. What should you do if you have been trying for a long time? If you have been trying to conceive for more than 1 year, if you are under 35 or more than 6 months, if you are 35 or older, it is a good idea to speak with a qualified healthcare provider for a comprehensive fertility evaluation. Very, very important. This may include assessing evaluation hormones. This may be just those kind of things. We are going to be including assessing your ovulation, your hormone level, your semen analysis, your uterine anatomy, and fallopian tube potency, depending on your situation. Do you understand? So that is it. So my encouragement to my beautiful TTT mamas, please don't lose hope. Sometimes the delay isn't because fertilization isn't happening. It may be because implantation isn't occurring at all. It's not occurring successfully, and understanding why is the first step towards finding the right treatment. Understanding. Remember, every fertility journey is unique. Don't compare your story to someone else. If this video helped you, please subscribe to my YouTube channel and share it with another trying to conceive mama anywhere. And tell me in the comment section, have you heard about implantation failure before? What question do you have about implantation? Thank you so much for watching. Bye bye.